question that often people get asked, what is going on in a traumatized brain? So the traumatized brain look different from a non-traumatized brain in 3 different ways. And I think we talked about it last time. The thinking center of our brain is underactivated. So, imagine that you're driving from Calgary and all of a sudden you took a wrong turn. Instead of going towards Lake Louise or Vancouver, you took it to the, hot springs or somewhere else in a direction. And you don't know for sure whether you're going in the right direction or not. There are no signs, nothing else, but something tells you that there is something wrong because you have never seen those mountains or peaks or trains or path or road ever before. And so, but then 100 kilometer into it, you don't really know what to do. Your brain is constantly anxious to find maybe another way that you could go back to your main road, or you are probably thinking of returning back and then traveling another 100 kilometer to set your mind up. So the thinking center is, also underactivated. You can't make the decisions. The emotion regulation center is also activated, underactivated, where our fear center is overactivated. And we talked about when your amygdala is actually overactivated, you overthink, and it creates many, many issues for your brain. We also talked about that there are actually structural changes in all of these centers, whereby the first 2 centers that we talked about, the prefrontal cortex and your cingulate complex, as well as the hippocampus, this is where memory is, they actually shrink in size, whereas the amygdala, which is known as the fear center, is enhanced or increased in its size. So we know that these are the structural changes that occur, and they occur not because of the drugs or medication or some other things, but through the usage of that network or the usage of that particular pathway. So because brain is so plastic and it changes all the time, it changes from one end to the other when we learn, but we can also unlearn. So many of these post-traumatic disorders that you see, the depression, these are in some cases structural changes, but in most of the cases, they are actually connectivity changes. And because brain is highly plastic, there is absolutely significant evidence to suggest that yes, you could actually correct, you could overcome, but in cases, most of the time, you really need to do the heavy lifting. But in some cases, you need the interventions, and there are many, many techniques and technologies, both kind of non-invasive or pharmacological, medicinal or medicational, that Dr. Rahman will enlighten us about, that you could actually see an expert and then either psychotherapy, or you could do many other approaches to be able to bring yourself back to where you were before.
I think this leads us to the next question, because when we are talking about recovery, I recently had some conversation with a person who was going through a trauma, actually 7 years of domestic violence. And there are some conditions that she's going through after she came out of that situation. And those include insomnia and other flashbacks and other indicators. And then there is a question of medication. And some people actually fear going to the psychiatric or treatments because of the medication or depending on the medication for their lifetime. And now I have exactly a question on that thing. And I would ask Dr. Abdul Rahman to enlighten on us that does a person recovering from trauma need to take the medication for lifetime? The dependency is for the lifetime?
The short answer is no. But it also depends on what the problem is. Because as Dr. Naweed pointed out last time and had alluded to this time, there can be different presentation. You can come with anxiety, you may have sleep problems, you may have depression, you may have just a heightened vigilance. You're not able to function that way. So it really depends on what it is. But in most circumstances, you don't have to take these medication for longer than maybe a year or so. So it really depends on what it is. So you really want to recover from the symptomatology that is coming up, that is interfering with your life. And unfortunately, as you know, antidepressants or anti-anxiety medications are not what you call curative. They don't fix you forever. They basically could treat the episode, and you may have the underlying problem or neurotransmitter deficiency that may come back again. So that's basically how that is. Maybe I can address this when we talk about the individual disorders, perhaps. But I do want to go back to what Dr. Naweed was saying. If I can share my screen a little bit, I don't know.
Yes, you can, sir.
Let's see. So I think the point I want to share, I don't want to get into a lot of presentations, but I think I just want to share, some of the main thing that I will be concerned about. And so this is kind of this is not really an actual picture, but it is kind of fairly good kind of reflection of how the brain looks like. These are the neurons making connections. As you can see, some of them are more alive than others. And this is a little more of a closer look. As you can see, they're holding hands. They're talking to each other. And these cells grow as we develop and as we form connections, as we learn things. And these keep on increasing. And different parts of the brain need to talk to each other and basically provide the complementary learning. And that's the whole process about that. But what happens when the experiences are very negative over a long period of time, as you can see, those connections start to and begin to die down. I think this is a kind of a good way to look at it, what happens to our brain. It is really important that I decided to bring this visual so that people can understand that there is a change. It actually is a structural change. It's not the damage that you will have in way of having traumatic brain injury, lacerations of the brain, or part of the brain is chopped off, or there's a damage to the brain. It's not like that, but it is connection that are there between the brain cells. So, and this usually is seen where the injury and trauma occurs over a longer period of time. So single episode of PTSD probably will not do this. And most of the time you see Dr. Naweed Syed, I think, pointed out last time that, there are no structural changes. And that's why we don't see structural changes like that in single episode of PTSD. But that's where I wanted to bring this back for discussion. I was saying earlier, we really need to look at repetitive trauma. It may be PTSD or maybe other kind of trauma that are really, really very important for us to understand. And I think those are the things that we need to keep in mind, that these things do happen, and for that change to reverse, we really need to re-experience life. And as he was pointing out, the whole milieu and the environment and the systems and the experiences and re-experiencing some of those things may help us, particularly earlier age. And in fact, I would say it's accurate statement. Earlier the intervention is, better the outcome. And longer in fact, I may have a slide, I will show you that. Just to go back to that for a second, just to develop how that is correlated so the brain ability to, this is from Harvard, the brain ability to change in response to experiences is really high in the early years. And as the life goes on, that frequency, that probability goes down. And then the orange line is the amount of effort needed to produce that change. as you can see earlier life, you really need to have even less effort, but you have to have an effort to reverse that. Whereas as the time goes, you really need to have work hard. So it is difficult if you have skipped an opportunity to learn early on and reconstruct. You will have very huge difficulty actually repairing that thing. So those are important pieces to keep in mind when we are talking about how what happens to brain and how do we need to change the environment. I think the whole idea. I'm a psychiatrist, a medical doctor, psychiatrist. I'm not a the kind of a high flying or high profile scientist that we have here in our meeting. So he probably is more knowledgeable on the cellular and other things, and I don't typically advocate for medication when I don't think those medications. I work in multidisciplinary team environments. I have psychologists with me. I'm very fortunate to have really highly respected people, and so family therapists and all these other people. And these are the people who actually give ideas as to how to change that environment to create that nurturing. So it's not the medication that is really important. It is what really we are doing to undo those experiences. And those undoing of the experiences cannot come through medications. I quite often say, pills don't give you skills. So if you really want to develop those lagging skills, you need to work with somebody who can help you with that. And we need the whole village to raise our children.
Definitely, that is true. And that is why I see that when, especially the clients who are coming and fleeing from domestic violence, all the organization make sure that they are giving a very comfortable and nurturing environment just to help them heal and reversal of those experiences they had in their life. I have one hand raised from Mona, and I think she might have a question exactly about this point. So Mona, you can talk. I'm allowing you to talk if you want to share your question with us. So Mona, please unmute your mic.
I'm sorry.
We can hear you now.
Yeah, it was actually by mistake, but yeah, it's interesting. Sorry about that. If I have any question, I will write it down in the question answer section over there. Thank you.
Thank you, Mona. So Dr. Abdul Rahman, you mentioned about the age factor, and that was the next question that I was going at, that is the recovery or the healing process affected by age? And now that you showed that graph, that exactly meant that at the older ages, a lot of effort is needed to make that recovery process. Yeah. There's another question, and there's a myth that men are strong-willed, they quickly recover. And then there's another instance that women take more time because they're sensitive or emotionally weak. Dr. Naweed, do you think that the neurosciences have some, preferences that we have about the gender response of trauma and the healing process in male and female? And this myth that women take more time in recovery process and then males quickly recover?
I think, again, that's a really wonderful question. And there is no basis for it, that one recovers faster or the other. It really is that we kind of, Dr. Rahman is one of my favorite, not only as a person, but also as a physician as well, that, he said pills don't really, they only manage patients. They really don't treat them. So you need to really think out of the box. Most of the psychiatrists will tell you, take this pill and you will be chill, right? So, but in his particular case, he actually knows that most of these medications only manage patients, they don't treat them. So that's a take-home number, message one. The longer you rely on him, the more you give away your own ability to come back to your original self. So, we talked about sometimes ago that cells that fire together, they wire together. They fire apart, they wire apart. And cells that fire out of sync, they fail to link. And this is exactly what Dr. Rahman showed beautifully. The cell, if you don't use a particular pathway that gives you the rational, emotional control, all these aspects, they will, if you don't use them, you lose them. And once they fall apart, if you get older, it becomes really difficult because you don't have those growth factors, the strophic molecules, the same zeal and zest. But then you get focused on particular aspects that a young person will say, whatever, right? So we men never grow up. So we always, stay at the younger age. And this is maybe why we might heal, but there is actually no scientific evidence for those. So I think, women, men brain, there is no difference. It's just that women end up really doing multitasking that we men tend not to do as well or as often. So their mind is actually engaged in so many different frontiers that to block all of those plug holes that are really draining their emotional energy or their mental energy, it causes the mental fogging more so than men would do, right? So I think it's really is that, the tasks are so broad and so many that these plug holes are often difficult to plug, and then they eventually really fall apart. But women are mentally much more stronger, much more resilient, and I think much better in terms of recouping and recovering from any of these traumatic events in their lives.
Thank you, Dr. Naweed. And I think now a lot of people would have this information that there is no like a preference of a male or female brain in the recovery process, and both are equally, their response to the recovery is equal. Now, the next question that I have is actually something that Dr. Abdul Rahman already pointed about, that the pills are not something that is the only solution to it. And that brings us to the next question, that some people say that only pills will heal us. Some people say that only counseling or therapies or psychotherapies will heal us. How do we tell them or inform them, make them aware of this balance? There's a preference towards one way of treating, or there is a balance and both go hands in hand towards the recovery process?
Great question. I think this is where I would like to bring some information on what I was talking about, other complicating things, other trauma that is not PTSD necessarily, but may have some PTSD at times, which is really, really critically important to give you a complete answer. And that is adverse childhood experiences. And there's a lot of studies and a lot of data available on adverse childhood experiences called ACEs. There have been studies earlier on, but Vince Felitti in 1996, 98, somewhere around that, and some follow-up studies of him, really pointed out that there were people who were coming to them for treatment of obesity who were not responding well. There were some who were responding, there were some who were responding, there were some who will respond and then not respond and fall back into the same pattern and develop the same issues again. And they ended up into an area where they were not expecting, actually. They did some research and found out that people who had adverse childhood experiences early on in their life have more difficulty coping with some of these things. And then later they discovered that, and many other groups did the same. And we actually did our own data collection in Calgary. And we have actually a ACE study group within Alberta Health Services, Child and Adolescent Mental Health Services. And a subgroup of that is a high ACE group, which is studying those who, when we find out somebody is on a high ACE scores, and then we follow them up and see what happens to them. In short, these studies over different, places and over a long period of time, this 20 plus years, have found out that people who have 4 or 5 or more ACE scores, this is out of 10, have higher rate of mental health disorders, and not only mental health disorders, but they may have actually 4 to 5 times higher medical illnesses, including asthma, gut problems, irritable bowel syndromes, obesity, hypertension, drug addiction, those kinds of things. 4 to 5 times higher, and also the mental health issues are higher. So what is it that we need to do about that? These are repetitive traumas over a prolonged period of time in life that actually changes how the immune systems and the how body responds. So it's not just the mind, it goes beyond mind. It actually affects your whole body, how the whole body responds to some of the chronic stresses before birth and after birth and at any point in time in life, and how do we deal with that. So I think that piece is very important. So people, coming back to your question, people who have experienced trauma in multiple domains, they have seen their mothers being slapped, or their mothers being threatened, or people drinking alcohol and yelling and screaming. These are 10 questions, very simple questions. I thought I'll present it here, but then I thought it will get more technical and complicated, so I really have omitted that slide. But these are simple things that happen to people in their life, and some of the cultures, I will not necessarily point out to one, but a lot of yelling, shaming, put downs, those emotional and some physical, financial, economical, and all kind of abuse is so prevalent that we don't even pay attention to that. And these are the ones that when these children grow up who haven't had a good experience of what a childhood looks like, when they become parents, they have difficulty parenting their children because they don't know, they haven't developed the art, they have not learned those things, that's not part of their framework. How are they going to deliver what they were not able to learn? And that's where the medications have no benefit at all. I think this is where we need to work on the systems. As one of our, researchers who've done a lot of work in mental health, I think it was Ontario Child Health Survey, said, somebody asked him, "What do we do with these?" And he said, "It's like picking up children or picking up people from the river. The best thing to do is not to throw them in the river in the first place." We need to work on the issues. We need to work on the societal problems. We need to create those safe environments and safe societies where these people do not have those experiences. So, and then when it does happen, you want to bring them in safe cultures, safe places where they can re-experience life in a different way and rewire themselves. So, long answer to your short question, this is where medications have no role. Society has a role. What we do with them, and that's why when Sister Anila started this program, I was absolutely delighted that our community particularly shoves it under the carpet. We do not have these abuse issues. We have abuse issues. We have these problems. We need to face them. We need to create those safe environments for people who need to then relearn how to live, particularly children who accompany these women sometimes. They need to re-experience life. Now, what is treatable with the medication? There are a number of people who may have major depressive disorder, and that is a complete shift, not a complete shift, a significant shift from the general PTSD symptoms of hypervigilance and avoidance and those kinds of things that Dr. Naweed talked about last time. So you have, sleep problems, you have loss of interest that you were enjoying things that you were enjoying before, guilt, lack of energy, suicidal thoughts, poor concentration, lack of appetite, loss of weight, all these symptoms and chronic feeling of unhappiness that does not go away, particularly if it's a new onset. No, if you can see the body and the head and tail of the depression, then it is depression. And if you have it more clearly defined, starting from a certain age recently, then it is more amenable to change with the medications. But with these trauma patients, you almost always have to accompany that with the therapies that are useful. That may include CBT, that may include exposure, virtual reality exposures or other exposures. You can even do the EMDR with these people. So these are the three main groups of therapies that are useful. Similarly, if you have anxiety, sometimes anxiety is bad. Your whole body is aching, your muscles are tense, you can't relax, any time of the day. You may have panic attacks, your heart may be racing, you may have these episodes, you may have sweating for no reason, gut problems come and go, worries at night, all those kinds of things. If you have anxiety symptoms, then you can also treat those anxiety symptoms through the use of therapy or medication. So, as a general rule of thumb, I think for people to know, if you have moderate to severe anxiety or moderate to severe depression, you may need the combination. And if you have mild to moderate, perhaps you could possibly do with therapy alone.
Right. So then there is one question that is connected with this one. I have one question also in the chat box. I will put it forward also. Now these webinars and these sessions will also be shared and are also watched by some of the other organizations who are actually providing support to the victims of domestic violence or family violence, mothers and children who went through trauma. What would be your message for them, for those organizations, when they deal with these clients? What should they do for especially the children who actually see trauma in their life, who actually see violence in their homes? Now they are living with those experiences for the lifetime. What kind of health interventions they can bring in their system that can actually alleviate these kind of experiences and suffering for these children especially?
Great question again. I guess this is directed to me.
Yes.
Okay. I will start with what not to do.
Okay.
And I think forceful re-exposure is not helpful. And prolonged therapy where you re-injure or you traumatize these children, that's not helpful. And to give you an example, I saw a child and a mother, 5 or 6 years ago now. This was a family who had gone through repeated trauma experiences early in life. The child was young at that time. 10 years later, this is now they're still in therapy 10 years later. That is a problem. So I think these chronic, repeated talking about the past trauma, it does not help. Yes, there is a role in it because you sometimes need to, have a play, for example, where you allow them to express themselves, or you have art in which you allow them to express themselves. And, you can also, for the older people, you can still have the cognitive behavior work in which you talk about things rather than play. But then it has to come to a stage where you are helping them to experience life and help them move on rather than to remain fixated on what was causing the trauma, because it's not going to help. So I think one of the important things that we can do as systems or people who are trying to heal these people is to create environments where these children can experience normal life. I think that is very, very important. People who are healers, people who are helpers, children who are doing well, children where they are functioning well. And those are important aspects that we need to really take care of, because bringing a child and preventing from a toxic environment is helpful, because the first treatment for an exposure to a toxin or poison is to remove the poison. That's a simple formula. There's nothing, particularly spectacular about that. But after you've done that, then there is a problem. There's a second stage. You need to create those experiences that will help them to heal. And I saw there was a question, I think, that popped up was about resilience. And I think, when I see children, uh, and I've now made it a habit to actually do that with everyone. I used to do that particularly where there was a trauma history. I actually go and, first of all, when I meet with these families, I ask the mothers and the parents to give me a list of all the positive things about the child. Help us create a list of what is this child doing well. I think that's the important piece, because it's not about all the negative stuff. These children have lots of positive things, and you need to discuss that in front of them so that they can hear all that. And also providing them, if they don't have opportunity, there's nothing much in their life. We need to, as people, as society around them, it is our responsibility to create that environment that is healing, in which they can experience normal, healthy, happy life. And that has to be structured so that they are not overwhelmed, because sometimes they can get overwhelmed. It's got to be done by people who are trained and who are and done in a good therapeutic environment.
That brings us to situations that in life we cannot control all the incidents that happen, and there could be certain situations where there could be again an exposure to that situation. This combines two of the questions that I have, the resilience, and also Mona shared a question that a person goes to a psychotherapy for years, and then there is one incident and that recapitulate the previous experiences and all of the previous hard work they have done or the efforts they have put into the psychotherapy. It seems like it is again to the 0 point. So what a person should do when, after all of those psychotherapies and treatments, again one incident can re-trigger everything from start?
That's a great question again. I would like to bring two things into this discussion. One is about the repeated trauma. So, if you have been traumatized, you are sensitive to trauma. So you will be triggered. And so therapy, when we are starting therapy, we need to keep that in mind, that one setback does not mean everything is gone backward. In fact, this therapy that has taken place and has done some work has created what you can say is part of the resilience, because that's also a part of the resilience. They've been able to cope, they've been able to go out, they've been able to face those negative life events without really having a problem. I mean, I'm talking about the minor events that may trigger the reminders and memories of those things. So I think the important piece is that the therapist needs to know that this will happen, that this is not uncommon. And they need to not only be ready, in fact, they should ready their clients as well, that, this is a 2-step forward, 1-step backward formula. Things will happen. This is natural and it is okay. It should not be taken as a catastrophic failure or a fall from which you cannot recover. This is a step that will make you stronger, but we need to be ready for that. I think problem is when people think that, I'm going to treat you and you'll be healed and nothing will happen. That's really a kind of a what I would call too much optimistic outcome that we can tie to our therapy or our mastery in therapy. We need to be realistic about that.
Yeah.
And with regard to the resilience, again, people need to, these are people around who create this support group. and who continue to support at the time of these adversities, that is going to create the resilience. In fact, there are lots of scales of resilience that people can utilize and see where that is and how resilience can be built. But I think that one setback should not be a problem. And second thing is that, with the long history of trauma, this is one event, and this obviously will cause problems. But I think, again, if the healing has taken place, it's not going to reverse all of that.
Right. So, Dr. Naweed, I would like to ask you that now we are talking about resilience, and there's a question about how to help someone with a post-traumatic stress disorder. Dr. Abdul Rahman very beautifully pointed out about the importance of the support groups. So I would like you to highlight the importance of how the support groups actually develops the resilience, but from a neuroscience perspective, that if a person is living in an environment where there are people who are supportive for him, how the brain responds to such kind of environments, nurturing environments.
I think, again, Dr. Rahman is the best person to answer this, but I think I will build on what he said earlier, that, it is really naive to think, just like a pigeon, when it sees a cat, that it closes its eyes, it cannot see the cat anymore. So, thinking from the psychiatric or neuroscience perspective, that, once you have gone through therapy and you're doing fine, that things just disappear. Actually, these traumatic events are encoded onto your synaptic structures that Dr. Rahman showed. We call synaptic tagging. Specific synapses are tagged. Even in early childhood, they are tagged. But, child can be easily distracted into positive reinforcement. But oftentimes, these tags never go away. So I think, it's a naive to think that, if I haven't thought about this is really gone. Those are permanently. I think the modern psychotherapy, especially for children, people are using through play. They are actually distracting them through play, but allowing them to express their traumatic experience. And then the intervention comes in right place. But I think the situation is really different for grown-ups. The grown-ups need not just their own personal effort, some maybe, professional intervention, but the groups, support groups are really, really important. But they need to be people that you trust, people who are actually very close to you, they know the situation, and they're also professional and sensitive to make sure not to bring those kinds of things. So I think many a times a circle of good friends will help you reassociate your bad memories. So going with them to, for example, a park or a place where you had original trauma will actually rebuild those memories, but in a very different context. And so the positive reinforcement is really, really very important. And if you have negative reinforcement, you continue to tag those synapses in your brain, and they never go away. My 2-3 years of age memories are still encoded, but like I said last time, I forgot the name of the file and folder. I cannot recall it, but it doesn't mean that it has really disappeared. So I think when you're starting therapy or treatment or talking to these people, it's really important to realize that, accept that fact, that in terms of drugs, we will manage them. Psychotherapy, we will psychologically, emotionally support them. And then the support groups such as, CPSG, they need to be professional, they need to be sensitive, and they need to be really trustworthy. So people actually trust you and they're willing to open up and share. And then you actually work with them. So I think resiliency is not just a magical potion that you could just have it. And it is in all of us. But what we could do, as Dr. Rahman said earlier, it takes a village to raise a child. So I think we are embedded in the society. Members of the society messed it up for us, but there are members of the society who can also help fix it and bring it back to normalcy.
Can I just add something?
Yes,
Dr.
sure.
Naweed was saying, it just reminded me, kind of on lighter side. sometimes children ask me, you are only dealing with, talking and all these things, and it's not going to change my brain or whatever. Psychotherapy doesn't help. It's just a useless thing or whatever. And I say to them, are you looking at me right now, right? And the child would say, yes. I said, I've changed your brain forever. And they're kind of surprised. I said, I have literally changed your brain forever. And they initially don't believe me. And then I tell them that when you look at me or when you listen to me, there is a short-term memory. That memory is coded, that moves into the long-term memory. And when you see me again, you will probably need to recognize that you have seen me again. So how do you recognize me again? If you have nothing left in your brain, you will not know that I have changed your brain. So I think it's just one way to describe that these experiences that you have, that tagging that Dr. Naweed was pointing out, actually is very important, because we can begin to retag these by giving them different experiences. And that's why that other alternative experience in life is critically important.
I think also on the lighter note, because you should not have started me, somebody asked a psychiatrist, when the kid said, so what do you do? He says, I work with children. I am a child specialist. I work with smaller children. So he said, well, if you had studied a little bit harder, you would have been grown-up doctor. So, these kids are really, really smart, and they're very, very intelligent, and positive reinforcement, and seeing someone like a smiley face, a positive thinker like Dr. Rahman, half of their problems are really gone. So this is what we were talking about, resiliency. You need to go to people who you believe in, you have confidence, you have faith in, and you know that they are trustworthy.
Now, we are talking about the people who leave behind all of those experiences and move on to their life that is a better one without the trauma. I had one specific question from a female who wanted to actually get an opinion on trust, building trust, back with the person who inflicted the trauma. And in that case, that was the husband. And her question was, is there no hope for her to gain the trust back, because she's having a very tough time developing that trust again, because that was the source of trauma. That was the trigger. Whenever she sees his face, that is when all of those experiences in her mind are going to reel back like the memories. So is there any hope for people going through some situations like the one that I mentioned, Dr. Abdul Rahman?
Yes, there can be hope, but there are some caveats. And I will start with that. I think the problem is that, we as humans are social animals. We like connecting with people. We like to trust people. We like to go back to situations which were positive. So quite often, obviously, when people get married, in general, there are two kinds of marriages. One is that, your parents like somebody and they basically do that. That's typically known in our cultures. Or there could be, you meet somebody you like, and sometimes you don't even know the background, or you don't know the person, and you get married. And the reality is that sometimes you don't know the person even after you've been with that person for years, and it's really hard to tell. So problem comes when there is an element of trusting too much, or hoping against hope, or having a pattern. And I'm just saying globally that there are people who are so compassionate or so loving that they may go back to helping people who may be needing a lot of help themselves first before coming to terms with reconnecting. And I will give very bluntly, I'll give just an example of getting married to somebody who is aggressive, or who is a source of trauma, or who has inflicted trauma repeatedly, who's got a a personality which inflicts that again and again. And I think it depends on what that issue is. If you're married to a person who has a long history, has a pattern in an interaction with you and otherwise in life, who has been in trouble with the law, who has that nature, has a lot of anger problems, so those things should be addressed first. People who have history of anger needs to get the anger management under control. They need to go to courses. They need to fix the problem. There are people who have drug addiction. They need to treat their drug addiction. And, similarly, other behaviors. So they need to work on their stuff first, which was maybe cause of the problem. And then you can certainly gradually return to that relationship, making sure that, it's not all or none, that one day that you have broken the relationship, and other day that person wants to have a relationship with you. That's a recipe for disaster, in my view, because what has changed? So I think that needs to change first. And sometimes it's not just that other person, I must say, I should add that. It may be a two-way traffic. It may be that two people have their own problems. They both need to go for marital counseling, or they need to go for individual work and the marital counseling. I see that quite often, actually, that, it isn't one person. And sometimes it's a mental health issue, as simple as that. I see, when I'm seeing children with ADHD, I interview the parents, and we as a team, and we find out that the parents may have their own ADHD, which has been not treated, and that's why they have been finding it hard to deal with these children. So you need to treat their own mental health issues individually, or whosoever has it, they need to work on their mental health issues. They need to work on their anger issues. They need to work on basically the primary problem that led to this, difficult phase in life, that you were separated. And once they have done that, there's no harm in coming back and having some clear boundaries and rules of what will be tolerated or what will be not. I don't think that, and I'm saying this as who I am, as a Muslim and a Pakistani, that violence is not tolerated. It's not acceptable. That needs to change, whether that is towards children or that's towards wife or husband, for that matter. I know a group of people who have created an organization called AAH, Association of Abused Husbands. So it's not just women who suffer. There are women who are perpetrator of the violence. So that needs to be sorted out. I think, to basically sum up, answer to your question, the primary problem needs to be solved first. And then there has to be a process of how the reconciliation should happen.
I think, I would also like to tackle it from a different perspective. I think the issue is really the most important thing that binds all of us, be that in our academic institutions, jobs, community, personal relationship, is trust. So if a person's trust is breached, that is an extremely hurtful, thing. So if for example, in a marital situation, a woman finds that husband is cheating on her, right? And then caught, and also then at that stage, but the woman and men still want to really, carry their life through. So we have two really serious issues. One is whether the husband has apologized and whether the apology has been sincere with the intent of not committing. We're all humans. I think we all commit mistakes. We all make mistakes. And I think we should have enough, room in our heart to be able to forgive, and our brain to accept that forgiveness as well. So I think that is something really important. And the other thing is, when the forgiveness is given, we also have to give the other person a second chance, maybe a benefit of the doubt. Hazrat Ali has said in one of his hadiths that if you see a person commit a sin, next day do not identify it, promote it, or bring it up. because you don't know, in the middle of the night, he might have, asked Allah for forgiveness, or asked God for forgiveness, or the person against whom he committed sin, or transgressed, may have actually forgiven. So consider them as such, that they are sin-free. And I think what happens is, this allows us to let go, right? Not to really dwell on it too much. I mean, it is hurtful. It's very, very difficult because, in our case, we put so much trust on our personal relationship, and anything that breached, you can get in a lot of trouble. Even on my Facebook, if lots of women will actually like something, my wife will nudge me, who's this? So I have to tell her, calm down.
Doesn't happen to me.
Calm down. So, just calm down and relax. But, after a while, she begins to realize that, it is what it is. It's the part of the job or part of the tradition. She would also sometimes tease me that how come, all students and trainees in your lab are always good looking. I said, well, what can I do? I'm a good looking guy. I attract good looking ladies. So, that's really the humor is, I think, the biggest medicine that you could really give anybody. And I think in that particular, example that you cited, I think in our community, the breach of trust is really remarkable. For other people, jame jim se mera jame sifal acha, toot gaya dusra le aaya, that's okay for the Western world. But in our culture, the women or even men, they actually trust each other to that extent that is really hurtful, and it hurts. And oftentimes you will not find room. The devil keeps coming and says, no, you did this. And you keep bringing it, it reinforces it, and the circuits get even more tagged, and then the relationship gets worse.
That brings me to another problem that we see in our culture, and that is the peer pressure and the importance of sabr and patience. And that's what is the lesson that is given to the females in the culture that we belong to, that no matter what, let it go. Be patient. There is a reward for patience, a bigger reward for you. And then over the period of time, it piles up to the point that there is no more room for sabr. There is no more room for patience. And that's when things come out the way that they never expected. And that's kind of like an explosion that happens, and that changes things abruptly and drastically. So I would like you to, share some opinions about what actually sabr means when we are talking about sabr. There are some people who are viewing us on the Facebook. There are some questions also that I would like to share, but I would like you to highlight the importance of sabr and what it actually means, especially in a situation where you are letting go of trauma or traumatic experience that you're having in a relationship.
Dr. Rahman.
I think, again, thank you, Dr. Naweed, for bringing a different perspective on that. And I broadly agree, but I will go back to what Zainab just said. There are things that accumulate, or there may be events that happen that are beyond the scope of a normal kind of activity every day. I'll just give you an example, and then I'll come back to this. And quite often when I'm dealing with children who have behavior problems and parents want, so we have started a new program called Collaborative Problem Solving. And this was by Ross Green, who wrote the book Explosive Child. And that has been now carried forward by Stuart Ablon. I did a replication of Ross Green's study here with some of my team members 10 years ago on the CPS model. But also Stuart Ablon was here, trained, people from Alberta Health Services and Hull Homes and Bootsum. He did 2 sessions for training on this particular event. And that is to train people how to work on not the behavioral model, but also collaborative problem solving, which is a child will do well if the child can do well model, and to really look at developing skills that are lagging, which causes the problem in the first place. So it's a very different model, not a punitive model. But when I do have to use the behavioral approach, And I tell parents to, on their way back home, they should buy 3 buckets, a very large yellow bucket, and a medium-sized green bucket, and a very tiny red bucket. And they say, what does that mean? I said, the yellow bucket is when you have to ignore things. And you have to be carrying a yellow bucket all the time when you are a family, whether you are a mother, or whether you are a husband or a wife. We need to tend to ignore some of the things that other people do, our children, our partners, other people in our family. So we just put those things in those buckets. And the red bucket is where, green bucket is where, which is medium size, we need to make sure that when we see something being done well, we need to say something. We need to say, whenever my wife cooks, and she always cooks good food, and that's why I have a big belly. I always say, praise her for cooking such a nice meal. And that gives rise to problems, because then she cooks more of that and then I eat more. So praising people is important. That red bucket is where you need to really, put your line. This is the red line and I need to consequence. And obviously it's going to be different for a husband or wife, going to be different for children, where they lose privileges or whatever else. But I think, again, coming back to, where we need to go with that kind of stuff, how do we deal with that? I think it's important that we have some parameters around that, and we need to make sure that we address those issues as they arise. And I think these are the things we need to really address.
So I think, I would like to add to what Dr. Rahman was just saying, that, of course, you could forgive, if you don't forgive or forget, small little things which are supposed to go even in a green bucket, we will never be able to live our life really at all.
True.
So I think it's really important. But at the same time, I think those people who are either habitual liars or they are repeat offenders, there are lines that needs to be drawn right from the get-go. So you need to know that this is where you have crossed the line, which is, I remember this person had spread the word that he loved his cat, so much. And then the wedding night, the cat goes meow, and he says, if you made one more noise, that's my red line. Right? And you know what happened to that cat? Dr. Rahman knows that. And then, that line is never crossed. The same way I think the woman could really do this, the same thing, that this is something that I will never, ever. So having open, frank discussions, really putting your cards on the table, drawing where the red line is, where the green line is, where the yellow bucket is, I think that really helps you avoid any major incident and traumatic events. And I think for sabr and shukr, again on the humor side, because I think humor is the best medicine. There was this very handsome, gentleman, and he looked at his wife. She was, just okay. And he said, Begum, hum dono jannati hain. And he said, well, how do you know we'll go to heavens? He says, tum mujhe dekh ke शुक्र करती हो, मैं तुम्हें देख के सब्र करता हूँ, और साबिर और शाकिर को दोनों अल्लाह ने जन्नत की ज़मानत दी है. They are guaranteed to go to heavens. So I think, again, for children and for younger kids, you need to really tell them where the boundaries are.
Yeah.
Which is that, in school, bullying is not acceptable. Somebody, you could ignore them certain extent, but there comes a time when you have to really take the action. I think if it is made a mandate throughout their professional, their early childhood development, they will know that, touching is inappropriately, is a behavior that is not acceptable. I think children will grow to become tolerant, but at the same time, keeping those confines of the boundaries that should never, ever be breached. So I think younger generation is far more kind of equipped that way, and they are told, not to put up. But if you look in Pakistan, for example, supervisor can abuse their students to whatever level they can. but there is no oversight. I think the same thing happens in the society, in the family relationships as well. So I think it is very, very clear to tell the cat that
no more meowing.
Then one other thing I like to add, and I think it's important while we are discussing all these buckets, is that we really have to also learn how to enjoy the differences that we have. Because if we don't have that, our life will be miserable.
Yes.
I can say to you, I have 4 kids. Well, they're not kids anymore; they're grown-ups. They all 4 of them have different personalities. But whatever they have, they have some very positive things and some quirks that they have. But we need to understand that. Similarly, our partners may not have the same liking that you have. So I think we need to understand that it is our responsibility to be with them when they're doing things that are not necessarily our liking. So I think that flexibility and that ability to enjoy life is critically important, because if you don't have that, you will be just being a manager in your house, which really is a very ugly way of living.
Yeah,
I totally agree. I think, I also surrender quite often. The other day, my wife, she made me watch this Bollywood movie, and 2 hours, my brain was going bonkers. And then when Shah Rukh Khan comes and he says, those beautiful dialogues, and then she's listening, then she looks at me and says, "You never say those things to me anymore." I said, "You know how much he charges? He's the richest guy. He charges 4 crore rupees for just those 4 dialogues. If somebody gave me even a small portion, I tell you, I'll be singing."
Wonderful. But that is the beauty of life. You embrace the person with their flaws.
Yeah.
And when you love them, you don't pick and choose the qualities they have. You accept all of them as a whole. I have 2 questions, then I'll wind up. Whenever I have a conversation with Dr. Naweed, I never, have the realization of the time and putting a cap on the conversation. Now, today we have Dr. Abdul Rahman, and we are already more than 60 minutes and still, getting the conversation interesting by every minute. So the first question that I would like to ask is from Sophia Ali Khan, and I think this is something that needs another session, but she wants to know about bipolar and narcissistic personality disorder. Briefly, the red flags, Dr. Abdul Rahman, she wants to know. So she's with us on Facebook, and that is what she's asking at the moment.
Okay, so for narcissistic personality disorder, all you need to do is to study a leader south of the border. That's it. That is my diagnosis. So that should be easy.
And we have a profile of personality also.
So one of the forensic psychiatrists actually from Harvard made that diagnosis. It's not just me. I'm not the one inventing that. And that was actually, she came on the screen and she described exactly the features that are there in that particular person of narcissistic personality disorder. So, and primarily it is excessive self-love, which overrides everything else. And it is a ingrained, long-term, pervasive pattern of thinking, and everything else that is behaving is circles around that. And certainly we can have a full session on that some other time.
Yeah.
With regard to the bipolar disorder, there are 2 parts to it. One is the depressive part, and the other is the manic part. You usually have both of those. The cycles of that can be very different. So some of those cycles are rapid. So you can have actually many episodes happening in a year. And sometimes you may have only 1 episode of depression and the rest is manic episodes, or other way around. And sometimes you have a mixed bipolar in which you have both manic and depressive symptoms. But the key thing is that when you have manic symptoms, you have a very distinct pattern of behavior. And, you have, too grandiose thoughts. So you believe in you're a god or something special. You'll be talking a lot. You will be having other delusions. You think that you don't need sleep. You may sleep only 2 hours and wake up fully fresh. You may have experience of racing thoughts. You may have highly sexualized behavior. You may be spending a lot more money. And this comes in episode. As I said earlier, it is that the animal with the head and tail, this is actually probably most true about the manic episode. You have to see a body and the head and the tail of it. It does not stay forever. That's a different thing. There's something that is looking like, chronic mania, but that is, hypomanic personality types, and that's a different discussion, in which you have these symptoms that I just described coming all of a sudden, and then going on for, some period of time, maybe weeks and months, and then settling down, having a normal period in between, and then having a depressive episode. And the features mostly of depressive episodes will be, again, a sudden shift from the normal functioning to being sad or irritable, and having sleep problems all of a sudden. You may be having difficulty sleeping anyway at night, but also another characteristic is early morning awakening, in which you're waking up early, you can't go back to sleep, you're still tired, but you're really not going to sleep. And you have loss of interest, things that you used to do before. You feel guilty for not doing anything, for no reason. You blame yourself. You feel tired all the time. You don't want to do anything. You're on the couch all the time, and you have poor concentration. You may have loss of appetite, and you are losing weight, and suicidal thoughts and attempts. That package comes separately another time, with possibly a period of normalcy in between. You have to meet certain criteria to be able to meet the diagnosis of bipolar disorder. But that's in a nutshell.
Right.
I think, you have to nail Dr. Rahman on this particular topic for another session, because I think this is really one of the most important questions. And I think the most important session could be really dedicated to it, because, when people who have, maybe my question to Dr. Rahman is that, these folks who can keep both primary and secondary processing in their brain concurrently. Normally, we know how to block things off, right? So we can block it off. We can block off noise and other signals, and even lights, for example. But in some cases, people have difficulty blocking those primary and secondary processing in their brain. But these are the people who will have the manic, maybe bipolar disorders, but they also have the most creative spells, where all of a sudden in this cloudy world comes this beautiful rainbow, or the light shines through the cloud. And that really shows them some of the most talented people actually have had these kinds of, mental issues, health issues. So, so my question really to Dr. Rahman would be, can these people predict as to what are the triggers for them that will cause them this downswing, and whether they could predict that now is the moment I have to take my pen out, I take my book out, and I have to write this thing down. This is my moment, this is my sunshine, this is my rainbow.
Short answer. With mania, usually there is a fairly poor insight into all these things. So these are the people around you who will probably be able to observe the change. And, a lot of people, some of them I know, they can write poetry in this initial phase of mania. When they are a little hypercharged, a lot of thoughts are coming to their mind, they can write it down. And some of the Urdu poets wrote poetry by inducing a little bit of a hypomania, by drinking a little bit, or maybe even trying some pot. But that's really beside the point. The thing is that when they're going up in their manic episodes, they actually feel pretty good. And therefore, they really don't have a desire to tell people that I'm becoming ill, because they're feeling good. Whereas there is a larger, bit better insight when they're going into a depressive phase, because now they are really not being able to do things and they feel differently, they're gloomy, so they may be able to. And one other thing that is probably important also is that quite often the manic episodes are therefore called psychotic episode because there is a delusion attached to it. And when you're deluded, you really don't have any insight and you don't tell people that I am manic or I have an illness. Whereas depressives mostly don't have delusions, although there are depressive delusions that I am doomed, that there's nothing is going to heal me, I will never get better, my guts are rotting, and those kinds of things. There are nihilistic delusions that are depressive, but that's a rarer phenomena. So these people know a little bit more, but I think these are people around them who will first capture that there's a change.
So I think maybe in a nutshell, it's I think it's okay as long as you're talking to your walls. But the problems become when the wall starts talking back to you. I think that's when you really need to see a specialist like Dr. Rahman.
I think that Sophia has actually acknowledged and she's thanking you for the answers on both of these questions. That brings us to the end of the session, but with one question from Muzna. And she actually wanted to want both of you to share your opinions about the role of exercise that is being played along with the therapy. But I would like to rephrase is that medication, therapy, then there is the life improving practices or the quality of life that can be improved with the healthy practices. So for both of you, I have this question. Dr. Abdul Rahman, you can share your thoughts, and Dr. Naweed, you can share your thoughts as the key takeaways and the end of the session, that what is the importance of improving the quality of life, having healthy practices like exercises, along with psychotherapies and medication when you're recovering from PTSD?
Thank you. So short one for exercise, and then I'll give you a slightly longer answer. Yes, there have been studies actually which have proven that exercise does have an impact on mental health. And particularly also if you are significantly, depressed, and if you indulge into exercise, it can be very helpful. So I think in general, also it induces feeling of well-being. But I do want to say that it's not just the exercise. I think it's the how we lead our life and how we make choices. Human brain, and I think Dr. Naweed probably can shed some more light on that, enlighten us with his thoughts. Brain has lots of cycles. It's like, the light that God created moves in sinus motions. I hope most people know that. It does not travel straight. Light does not travel straight. It moves in sinus move up and down, up and down. It has a rhythm. The universe here he has created has a rhythm. The life that he has created has rhythm. You got to be in sync with the rhythm of the nature. Human brain has a rhythm. We need to respect that, and what we need to do for ourselves is to respect the rhythms of life that is in us. We need to sleep on time. We need to have enough sleep. We need to eat on time. We need to have good nutrition. We ignore the importance of micronutrients that are essential for the growth and the functioning of our brain. We need to pay attention to that. So diet and sleep are critically important pieces. And during the day or whenever you have time, we also need to exercise. That releases endorphins and other hormones that are critically important for a sense of well-being and for also regulating other functions of the body, including the mood.
Dr. Naweed?
I think, beautifully put together. I think, exercise, it has even been shown in rats and primates and monkeys It actually creates new synaptic connections in their brain. And it also actually releases hormones that Dr. Rahman talked about, endorphin, serotonin, dopamine. And these are the trophic molecules that allow you to give you a sense of wellness, sense of well-being. And I think when it's coupled with rest, sleep, which allows your brain to really heal or recover, or to really, bring the rhythm back into things, that's also important. And I think one of the most important things that we often ignore is the meditation. Really meditating and thinking about, getting your brain, as Dr. Rahman said, in sync with the rhythm of the nature, connecting to the greater being. And when I visit many of these patients in the hospital who are really, end of life kind of situation, and when I talk to them, what it is that bothers you the most, or you're longing for most. And they said, cancer pain, I can manage chemotherapy, I can do radiation, I can manage. But one thing that really bothers me is my spiritual pain. And I now regret that I did not connect with the being, the Almighty, the God. And I think meditation combined with good health, exercise, and also sleep are really the key ingredients for the mental wellness, mental health, or brain health, as Dr. Rahman pointed out. So I think it's not just one thing, but it's a combination of different things. That when you make it a routine, not just like, they say that it's not that the obesity runs in the family. Actually, no one runs in the family. And so, many a time those kinds of things come in. The depression is the similarly. People go into dark places, no sunlight, no serotonin, no vitamin D. You go into the spiral that really sinks you even further. So I think, exercise, diet, meditation, they will cause the release of trophic molecules in your brain, in addition to endorphins and morphins that make you feel good, right? But the trophic factors go behind and they work to strengthen your good synaptic connections. And as a result, you actually become a much healthier, both physically and mentally as well.
Now that you both have talked about the rhythm, someone is saying, Khan Shabana is saying that unfortunately this pandemic has created abnormalities in our routine and we have lost that rhythm. So that is the difficulty that we have, that our days and nights basically don't have any routine. I think I won't end my session without having some message for the audience that are listening to you before the holidays start, and the message from you for their well-being also. The one last message.
Rahman.
I thought you were going to say something. I think despite of all these challenges, life is still beautiful. I think we need to recognize that. The realization has come to some of us that we thought we were masters of the universe. We are not. An invisible virus have taken us to our knees, and we can't even do anything much about that. Hopefully with this vaccine, we may have some outcome. So this should really give us and provide us an opportunity to gratitude, to thank him for whatever he has given us. And there's so many things that we still have. We should utilize this time to build those relationships which we have ignored for a long time, talking to people, building relationships, socializing, putting the cell phones away and the multimedia. Unfortunately, I'm spending more time on Zoom than I used to. So I need to work on my problems. We all need to do that. I think, again, we can still do the rhythm, most of the rhythms. For example, we can sleep on time. We can still have, meals on time, more with the family now than we used to have. And we can also go for, a walk outside. Because, by and large, this winter and winter is starting in a few days, has been pretty mild. So I think we should all move forward and make sure that we utilize the best that Allah has still left with us.
I think, for me, spending, 8, 9 months with family, I have learned that they're not that bad people, And the other thing I actually learned is that, I hear from many parents, they come and say, our teachers for our kids were not really the problem. The problem is our kids. So I think, what I have also learned is that, life is beautiful. Sometimes, we do not connect with life. It disconnected. I felt that I actually connected back with life. I read things that I otherwise would not have read. My house is now, really books are everywhere, and things that I would not have gone into, ancient literature, reading about poetry, connecting with people. I think I have discovered a new self of myself. And I realized that, I don't go to work, the life goes on. I think I'm the most important person walking on the earth, that life will, but I look at outside, the trains are still going, the buses are going, the planes are flying. And I kind of become like a dog that sees the passing car. I get excited, and when they try to take me out, I'm really happy. So I think, I have really learned many, many important lessons, and I still wake up the way I normally do. I still take shower, I still dress up, I still really function as if I am still at work, right? So it's not really what you have, it's what you do with what you have. But sometimes when the rhythm or the frequency of light or other waves, when it actually is bended, you can look at simple things, light bends in water, right? Liquid. You put a pencil in your cup of water, you will see it is actually tilted. It is only a perception, but in fact, it still is within the sync and rhythm. It just really need to be recalibrated. We need to really appreciate life. We need to appreciate family. I mean, think of yourself without a job for one day, then how much you actually love your job. Same thing is with friends connecting. I mean, I have really caught up with my friends that I had almost forgotten about. So I keep 1 or 2 hours really making that phone call and making that connection. So I think we have learned to connect with nature. We have learned to connect with the loved ones, friends and family. And I think that I like that rhythm a lot better because it had made me realize what are really the important thing in life that I had lost contact with. So I am back.
Wonderful.
And sun is still rising from the east and setting in the west.
And the life goes on. So I have a lot of praises and thanks from a lot of viewers on the Facebook. Then thanks from the Canadian Pakistani support group also for sharing this time with us, enlightening us with information that can actually change lives, that can help people who are going through some very difficult situations. So very, very thankful to both of you for your time. And there are some more, there are a lot of comments coming up that we really enjoyed this session. This was a good combination of humor, but also knowledge and opinion. So I enjoyed this 1.5 hours, and I think we just did a wonderful job, and I'm glad that we did it. So thank you very much. This marks the end of it. And inshallah, we will be meeting soon for some other session that can help and change a lot of people. So please do take good care of you and the people who are listening. I think you have a lot of things to reflect back on. Please take good care of yourself and the people around you. That's the beauty of life. We accept it with ups and downs. Allah Hafiz.
And thank you, Zainab, for being a good host.
Absolutely.
I tried that. I will do justice with this session, and I'll try to help the audience who want to hear some very important knowledge and discussion about this topic.
Phenomenal.
Thank you.
Thank you.